from school, and I was told that hypertension is essential. There's no such thing as essential hypertension. There's always a cause for hypertension. And the number one cause that I have found in the last 10, 15 years, it's hyperinsulinemia. So I'll give you a typical example. Young guy like you comes to the office, he's got no other problems, my blood pressure is high. I bet you he got insulin resistance. And I measure his insulin levels, this guy high. Bring his insulin levels down. So now he says, well, my doctor told me I have to be on blood pressure medications forever. I was one of those doctors. Then you have to be on blood pressure medicines forever. You can't come off this, you got hypertension. And I have realized that that's absolutely not true. If you find a patient who has essential hypertension, I now look for hyperinsulinemia. And invariably I do find it, bring it down through dietary changes and lifestyle changes, and the blood pressures go away. And I've done that to hundreds and hundreds of patients in my office. So insulin causes hypertension. I just told you, vasoconstriction, and it doesn't allow your blood vessels to dilate appropriately, and that causes hypertension. So when you look at metabolic syndrome, part of it is hypertension. And this is how it works. It's all because of hyperinsulinemia. So it causes hypertension, it causes hardening of the arteries in all your organs, and then you're going to feel the symptoms of that organ, whether it's your brain, your kidney, or your heart, or even your peripheral vasculature, or even endothelial dysfunction causing erectile dysfunction. So as a cardiologist, I don't see those patients, but my urology friends and I have now got this rapport going that, hey, you see those patients with erectile dysfunction, they have endothelial dysfunction. If they have endothelial dysfunction, there's something going on. You should be looking at the insulin levels. And it's been very exciting because we've actually restored endothelial dysfunction in these types of patients by appropriate dietary interventions and reducing the insulin. So you can see that it has ramifications beyond what we imagine, because it just depends which organ is being affected by the dysfunction due to the hormonal imbalance of hyperinsulinemia. Yeah,
It's so true. You know, in the traditional model of medicine, well-intentioned, it was